We are in part 6 now. This is the last part of this cardiovascular system. We will talk about path of circulation. Okay, remember, there are two main paths of circulations in the cardio system, which is the first one is pulmonary circuit, and the second one is the systemic circuit. Okay, and remember again, for the pulmonary circuit, it starts from the right ventricle, and it will end to the left atrium. Okay, so ventricle is the chamber that pumps the blood, while the atrium is the chamber that receives the blood. Okay, so pulmonary circuit starts from the right ventricles. It will go to the pulmonary trunk. And just remember, between this right ventricle and pulmonary trunk, there is a valve. It's called the pulmonary valve. Okay, and then pulmonary trunk will branch into smaller artery, which is right and left pulmonary arteries. Okay, so the left one will go to the left lungs, the right pulmonary artery will go to the right lungs. And again, remember, for this blood that is present in the right ventricle will be poor blood. It does not have oxygen on it, so it will be delivered to the pulmonary trunk. It's gonna be also poor blood. It's gonna be blue in color if you check the color of the blood vessel. Right and left pulmonary arteries will also carry poor blood. Okay. And then they will go to the arterioles. Okay. And then arterioles with the venules will combine to make these capillaries. And in this capillary, mostly oxygen will be entering into the blood vessel from the alveolus, okay, from the lungs. And then these venules then will carry rich blood. Okay. And all the venules then combine to make the vein, and there will be two type of vein, okay, two pulmonary right pulmonary veins and two left pulmonary veins. So total there are 4 veins that will enter into the left atrium, and this left atrium will have rich blood, which is the blood that will have a lot of oxygen, and the color will be red. So the blood vessel color will be red in this left atrium pulmonary veins. Okay, and again, arteries, pulmonary arteries will have low oxygen level and high carbon dioxide level. And then gas exchange will be happening in this capillary. Okay, carbon dioxide will go to the lungs, while the oxygen will enter into the capillary, into the veins, and finally will enter into the left atrium. Okay, so the rich blood will enter into the left atrium. So this is the first circulation. Is called the pulmonary circulation or pulmonary circuit, and the main goals of this circuit is to get oxygen from the lungs. The second circuit is called the systemic circuit, and the primary goals of this systemic circuit is to give oxygen to carry blood to our body tissues. So all our body cells require or need oxygen. Therefore, this circuit will provide these oxygens to all cells that need them. And then it starts from left ventricle. And it's actually start from the left atrium. Remember left atrium, that the chamber that receives blood from lungs, from the pulmonary vein. It will have a lot of oxygen on it. So this is rich blood. Enter into the left atrium, and there will be valve over here. So between from the left atrium, it will go to the left ventricle. And there will be valve over here. It's called the bicuspid valve or mitral valve. And then go to the left ventricle. And from the left ventricles, the blood will be pumped into the whole body. Therefore, this systemic circuit starts from left ventricle, and it will end to the right atrium. Okay, so left ventricle will have rich blood. Okay, and then it will pump into the aorta. Okay, this is the biggest artery in our body. And between left ventricles and the aorta, there will be valve. It's called the aortic valve. Okay, so it will pass this valve to the aorta. Aorta will carry the rich blood, and then it will branch into many arteries. Okay, and these arteries will be, the name will be based on the organ that receive the blood. Like for example, there will be a renal artery. This renal artery will carry blood to the kidney. So this is the aorta. So it will branch into many arteries, and this artery will carry rich blood to each organ. And then inside the organs, this smaller artery become arterioles, which is the smallest, one of the smallest blood vessel. And then with the venules, it make the capillary, and there will be exchange in the capillary. Okay, mostly oxygen will be delivered to the cell. Oxygen will be delivered to the cell. Okay, and the cells, after using the oxygen, will produce the carbon dioxide, and the carbon dioxide will enter into the venule. So starting from the venules, the blood is become poor blood. Okay, no oxygen in it. And then these venules will combine into veins. And the name of the vein will be based on the organs that have that capillary. So for example, from the kidney, the names will be renal veins. And many veins is actually will combine into Vena Cava. If it is coming from the lower part of our body, the Vena Cava is called the inferior Vena Cava. If it is coming from the top part of our body, that Vena Cava is called the superior Vena Cava. And these two Vena Cava will enter into the right atrium. There is another blood vessel that also go to the right atrium, which is coming from the cardiac muscles. So the veins of cardiac muscle is called the coronary sinus. Okay, and all of these blood vessels carry poor blood to the right atrium. So just remember, there are 3 veins or blood vessels that enter into the right atrium. inferior vena cava, superior vena cava, and coronary sinus. All of them carry poor blood. And just remember again, from the right atrium, okay, then the blood will enter into the right ventricle. And remember, there will be valve between right atrium and right ventricle is called the tricuspid valve. Okay, and then this right ventricle start the pulmonary circuit again. Okay, that's continuously like that. So this is closed circulation of blood in our body. So between the pulmonary circuit and systemic circuit, there will be continuously circulating the blood. Okay, if you see these diagrams, this is the left one is the arterial side, which is, this is the systemic circuit only. So this is arterial blood vessel. And the right side is venous blood vessel. Okay, for the systemic circulation, arterial blood vessel is the one that carry blood to the whole body. It will start from the left ventricle. To start from left ventricle. Okay, and then from the left ventricles, the aorta, okay, the blood will be pumped into aorta, and aorta will branch into many smaller arteries. The first artery that will be branched from aorta is the one that go to our cardiac muscle. It's called the coronary arteries. And then there will be 3 branchings on the arch of the aorta. On the right one, there is a brachiocephalic artery. And this brachiocephalic artery will branch into right common carotid artery. It will give blood to our right side of the brain. And then the right subclavian artery will give blood to our right arms. On the left side, it has 2 branchings from the arch of aorta. The left common carotid artery, it will give blood to the left side of our brain. And the left subclavian artery, it will give blood to our left arms. So this is the one that go up to our part of our body, brains and upper limbs. And then this aorta will be going down. It's called the descending aorta. Will be passing the thoracic cavity, abdominal pelvic cavity, and finally, at the end of it, it will branch into right common iliac artery and left common iliac artery. And these 2 branching will give blood to lower limbs, to our legs, right legs and the left legs. Okay, so this is the end of the aorta. So aorta is actually coming from the left ventricles. It will be ascending aorta going up, branching into coronary arteries, left and right. And then arch of the aorta, curve over here, it will branch into 3 arteries, brachiocephalic, left common carotid artery, and left subclavian artery. And then going down as the descending aorta. And the end of descending aorta will branching into right and left common iliac artery. But in the middle over here, in the abdomen, this descending aorta will branch into many smaller arteries that will go to each organs that we have in our abdominal cavity. For example, kidney, okay, receive the branching of the descending aorta is called the renal artery. So this is the arterial blood vessel. Inside its organs, then these arteries will become arterioles combined with the venous to make capillaries, and then these capillaries will make the vein. Okay? So vein on the right side over here, like for example from the kidney, the vein that out from the kidney is called the renal vein, left and right, and from the lower part of our body, there will be also external iliac vein and external left iliac vein. And all of these veins, smaller veins, will combine into bigger vein over here is called the Vena Cava. And again, the one that coming from the bottom part of our body, combining all the veins from the organ from bottom part of our body is called the inferior Vena Cava. Okay, so this is inferior Vena Cava. Inferior Vena Cava. And if you see this from the brains, there will also veins, and also from our arms, upper limb, there will be also veins, and all of them will combine to make this superior Vena Cava. And these two bigger veins, superior Vena Cava and inferior Vena Cava, all of them will enter into this right atrium. So return to the right atrium, returns all the poor blood to the right atrium. And also from the cardiac muscle, there will be coronary sinus that will also enter into the right atrium. Okay, just remember again, there are 3 blood vessels that enter into the right atrium: superior Vena Cava, inferior Vena Cava, and the coronary sinus. So this is the venous blood vessel. Now we're gonna we focus on the aorta. Again, this is the largest, okay? This is the largest blood vessel or the largest artery, because this is carry blood from the heart. Therefore, this is type of artery. So this is the largest artery in our body, and the portion of this aorta is called the aortic root, will be attached to the heart. It will be divided into 3 main portions, which is ascending, the arch, and also descending aorta. So if we make a picture, it's going to be like this. Okay, so it's coming from the heart, and this is coming from the left ventricles, right? So this part over here is called the ascending aorta. The arch is called the aortic arch. So this part over here is the aortic arch, and the one that is going down, so this whole part over here is the descending aorta. Okay, so between the left ventricles and the aorta, there will be valve. It's called the aortic valve. Okay, and the ascending aorta will branch. So this is the first branch of aorta, will branch and carry blood to our heart muscle. And these two smaller artery branching from the ascending aorta is called the coronary arteries, which is left and right. Okay, so two arteries are coming from the ascending aorta. Okay, over here. Now for the arch of the aorta, there will be three branching. On the right side, there is one bigger branching. It's called the brachiocephalic artery. On the left side, there will be two. One is going to our brain. It's called left common carotid artery. And one will be going down to our left arms. And this one is called the left subclavian artery. Clavia means wing, so consider our arm as a wing. So subclavian artery. The left common carotid artery will give the blood to the left brain. And how about the right brain? So if you see the brachiocephalic artery, then will be branched into smaller artery. The one that's going up is called the right common carotid artery, will carry the blood to the right side of our brain. And the other branch, of course, will go to our right arm. So this one's going to be right subclavian artery. Okay, so these are the three branchings of arch of the aorta. Now, how about the descending aorta? Descending aorta will be passing the thoracic cavity. So the whole things over here is called the descending aorta. Okay, the one that pass the thoracic cavity then is called the thoracic descending aorta or thoracic aorta. And the one that pass the abdominal cavity is called the abdominal aorta. And remember over here, it will branch into many arteries that give all the blood to organs inside our abdominal cavities. And at the end, this abdominal aorta will branch into left and right common iliac artery. And each iliac arteries will carry the blood to our lower limbs, left and right legs. So this is the aorta, the branchings of the aorta. And in the arch of the aorta, there is also baroreceptor. Baro means pressure. So there is a kind of cells in the arch of aorta that sense the blood pressure. If our blood pressure increase, for example, then our heart will lower the heartbeat. But if our blood pressure decrease, we need more blood, then the heart will pump faster and stronger. So there are several baroreceptors that will be located at the arch of the aorta. Okay. So again, we already talk about this arch of this aorta will be branched into three smaller arteries, brachiocephalic on the right side, and on the left side there will be two, left common carotid artery and left subclavian artery. Okay, so this is brachiocephalic, this is left common carotid artery, and this left subclavian artery. And this brachiocephalic artery again will branch into right common carotid, and right subclavian artery. The one that go to the brains, so from the right common carotid artery, left common carotid artery will give blood to the brain, and they will make circular blood circulation. It's called the circle of Willis in the blood. So actually both of the left and right common carotid artery, both of them will give the blood to the brains into the capillaries, and then making this circle type of circulation inside the brain. And again, aorta, yeah, this is going to be descending aorta, or because it is in the abdominal cavity, it's called the abdominal aorta. Finally, will be branched into common iliac artery, which is left and right. So this one, the one that give blood to the lower limbs. Okay, so this is right leg, and this is going to be give the blood to the left leg. Okay, this is the diagram that's showing you maybe clearly the branchings of aorta. So this is aorta. It's going to be ascending aorta. This is ascending aorta. This is arch of aorta. Okay, and ascending aorta will branch into two. You cannot really see it over here because it's covered by this pulmonary trunk. There's going to be left and right coronary arteries from the ascending aorta. Arch of the aorta will be branched into three. The first one over here is the brachiocephalic artery, and then this brachiocephalic artery will branch into right common carotid artery and right subclavian artery. On the left side, the arch of aorta will branch into two arteries. This is left. Okay, so this is the second branch. Okay, the first one is brachiocephalic, and then left common carotid artery and left subclavian artery. So this is the top part of the aorta, the ascending and arch of the aorta, and then it will continue as descending aorta going down. Okay. That's aorta. Now, if you look at the pulmonary trunk, this is the one that coming from the right ventricle. You see the color is blue. This means carry poor blood. Okay, so this pulmonary trunk only branch into two arteries. This one's gonna be left. Okay, left pulmonary artery, and this one is right over here. Right pulmonary arteries. And these two arteries will go to the lungs, left and right. Now look at the top one over here. So this is right ventricle. So remember, right atrium. Remember, atrium receives the blood, so the blood is going down here, and this is coming from the top, from the brain, and also from our upper arm. So this is the superior vena cava. Below this, you will see the inferior vena cava. Look at this. There are two red color blood vessels over here, and there is two red color blood vessels. So this is rich blood, okay, carry rich blood. It is coming from the lungs. So two left pulmonary veins and two right pulmonary veins. Both of them will enter into this left atrium. Okay, so from this color, you should be able to know which one carry rich blood, which one carry poor blood. So this one going this way to the lung, this is going this way to the whole body, and vena cava carry or return blood to the heart. to the atrium. This also return blood to the atrium. Okay, so this is the major branchings of aorta. Again, from the ascending aorta, there will be two arteries, right and left coronary artery. It will give blood to the heart muscle. Remember, muscles, okay, needs a lot of oxygen in order to contract. Okay, so this cardiac muscle receives the first rich blood from this ascending aorta. And arch of the aorta will be branched into three arteries: brachiocephalic, left common carotid artery, and left subclavian artery. And all of these carry rich blood to our brains and also our upper limbs. Now, the descending aorta, when it is passing the thoracic cavity, is called the thoracic aorta. It will give blood to, like, for example, bronchus, okay, so bronchial artery, pericardial artery, give the blood to the pericardium, esophageal artery, give the blood to the muscles of the esophagus, mediastinal artery, give blood to the mediastinum, and posterior intercostal artery, this give blood to the thoracic wall, and also muscle in between the ribs. So this the thoracic aorta. And then going down, there will be abdominal aorta. So continuously from the thoracic aorta become abdominal aorta. And remember, there are so many organs in this in our abdomen. Then there will be a lot of arteries over here. Okay, phrenic arteries, mesenteric artery, the one that give blood to our digestive organs, including stomach, intestine, pancreas. Right? Suprarenal, this is the one that carry blood to the adrenal gland. Renal going to the kidney. Gonadal, this is going to be on female side. It's going to be bring the blood to the ovary. If it is on male, it will bring the blood to the testis. Inferior mesenteric artery, this is also GI tract organ. Lumbar, this is going abdominal wall, okay, the muscle of the abdominal wall. Middle sacral artery, and the last one will be common iliac artery. There's going to be two, left and right. This is the one that carry blood to the lower limbs. So these are the branchings or major branches of the aorta. If you see these diagrams again, so this is ascending aorta, will be branchings into left and right coronary arteries, and then arch of aorta, so aortic arch, branching into three: one brachiocephalic, two left common carotid, and three left subclavian. And then descending aorta will pass this thoracic, going to be thoracic aorta, and then going to become abdominal aorta, and branch into left and right common iliac artery. And here inside the abdomen, it will be branching into many arteries. It will go to each organ, like this one over here. There is an adrenal gland, which also receive blood from the abdominal aorta. Renal artery going to the kidney, carry blood to the kidney, and many other organs. This is just the picture from scanning, scanning inside our abdominal cavity. As you see, this is descending aorta, or because it is in the abdominal cavity, it's become abdominal aorta, branching into this common iliac, left and right. And there are many smaller arteries over here branching from this abdominal aorta. This is the one going up to the brain, okay? And this is going to be the right side, because if you see the brachiocephalic trunk is branched from the right side of the arch of the aorta, going up, branching into right common carotid artery and right subclavian artery. So this is on the right side. And then this common carotid artery will be branching into internal and external carotid artery. So the external will carry blood to outside area of the head, okay, like for example the skulls, the skin of the head, and with the inside, the internal carotid artery will carry the blood to the inside part of the brain. Okay, inside the brain, if you see, there are a lot of smaller artery, posterior cerebral artery, basilar artery, vertebral artery, anterior spinal artery. There are so many arteries that will be branching from the internal common carotid artery. On the upper limbs and our arms, this is subclavian artery. So this is going to be the right side. So right subclavian artery. Then will be branching into smaller artery like radial artery. This is usually the artery that we use for palpations to measure the pulse rate. And there is also brachial artery. This is also another artery that we use to measure the pulse rate. In the thoracic cavity, in this case in the ribs, there are also smaller artery that bring the blood into muscle. Okay, so internal intercostal muscles and the external intercostal muscles. All of this muscle needs a lot of oxygen to contract, so they also receive the blood, the rich blood from the artery. This is the lower part, the pelvic regions, and this is still aorta. So this is abdominal aorta, branching into common iliac artery. This is on the left side, so left common iliac artery, the one that will go to our left legs or lower limbs. And there is smaller, internal iliac, so it's going to be branching into internal and external iliac arteries. Okay, so again, the common iliac artery, this is going to be on the right side. It is branching from the abdominal aorta, will be branched into external iliac arteries and the internal iliac arteries. So the external, this is bigger, it will going down into lower part of the legs, become femoral arteries, pubular arteries, and many other arteries that will give blood to the muscles and also bones of the lower limbs. Now we are in venous system, which is system that return the blood to the heart. Okay? For the systemic venous circulations, this is return the blood from all organs inside our body to the right atrium. Okay, so all this blood will return to the right atrium. This is what we call the systemic venous circulation. And again, all veins from the lower part will combine into a bigger vein. It's called the inferior vena cava, while all the veins that coming from the upper part of our body, from the head and also from the upper limbs, from the arms, will combine into superior vena cava, and both of them will enter into the right atrium. Plus, there is a coronary sinus from the heart circulation will also enter into the right atrium. So this is systemic venous circulation. The pulmonary venous circulation, this is the one that enter into the left atrium. So return blood into the left atrium, and all of them will be coming from the lungs. So it's going to be rich blood that coming from the lungs, and there will be four veins that enter into the left atrium. Two of them is coming from the right side of the lung. It's going to be right pulmonary veins, two of them, and also two coming from the left pulmonary veins. Okay, so there are four blood vessels enter into left atrium, all of them coming from the lungs. Okay, and there will be three blood vessels that enter into the right atrium: inferior vena cava, superior vena cava, and coronary sinus. Okay, again, this is major systemic vessel. It means that coming from the systemic circulation, all the capillaries coming from the bottom part of our body, it combine into vein, and finally making this bigger vein is called the inferior vena cava. And from the top, from the brain, from the upper limbs, then all veins will combine to become superior vena cava. Both of them will be entering into the right atrium. Okay, so right atrium receive blood from inferior vena cava, superior vena cava, plus from the coronary sinus. Okay, again, remember there are three blood vessels or veins that enter into the right atrium. This is the vein circulation, so the venous circulation from the top of our part of our body, and from the brains, from the head, there will be two big veins that will enter into the brachiocephalic vein. Okay, it's the right internal jugular. Okay. And then the right axillary vein. And this is coming from the right arms, and all will combine into right brachiocephalic vein, and finally will enter into superior vena cava. This is right external jugular. Okay, so vein from upper part of our body for upper limb, shoulder, abdominal, and also thoracic wall. So there are two systems that drain to the upper limb and the shoulder. Deep set of vein and superficial set of veins. You're gonna see the picture here. Okay, So all those veins will combine into subclavian vein that at the end will enter into the brachiocephalic vein. Okay, so coming from inside and outside part. Okay, this is cephalic vein, and the inside is the axillary vein. Okay, from the thoracic wall, from the wall of these ribs, okay, they all will combine finally into the brachiocephalic veins, left and right, and finally will all enter into the superior vena cava. So superior vena cava receive the vein from the brain, from the head, from the limbs, upper limbs, and also from the thoracic wall, from the ribs. Veins from the abdominal viscera or abdominal organs. Okay, most of the veins, okay, will enter into the inferior vena cava. Okay, like for example, from the kidney, so let's say this is the kidney, there will be renal veins, that will return the blood to the inferior vena cava. But there is a special circulation, is called the portal system, that return the blood actually from our GI tract. So our GI tract, let's say stomach, pancreas, intestine, okay, they will not return the blood directly to the inferior vena cava over here, but they will return the blood to another organ, is called liver. So all of them will return the blood to the liver first. Okay? So from one capillaries in the digestive organs to capillaries in the liver, that connection is called the portal system. The portal system is the system that returns the blood from one capillary into another capillary. And finally, from liver, then the blood will enter into inferior vena cava. So you see over here is a special circulation between capillaries in the digestive organs, stomach, intestine, pancreas. All of them will enter into the liver, and this is called the portal system. And because involving the liver, then the portal system is called the hepatic portal system. Hepatic means liver. So this is portal system that carry blood from digestive organ to liver. And then from the liver, this blood that carried from the GI tracts will be filtered by liver. So liver will remove or detoxify any bad substances before returning it back to the inferior vena cava. And then inferior vena cava will carry blood back to the right atrium. Okay, so this is special circulation between capillary, is called the portal system. Okay, this is the diagram that's showing you this portal system. Okay, remember again, if it is kidney, let's say if it is kidney over here, then the kidney will return the blood directly to the inferior vena cava. Okay? But for the GI tract organs like stomach, intestine, small intestine, large intestine, spleen, pancreas, all of them will return the blood to liver first. And this area over here, This circulation over here is called the portal system. So this is hepatic portal vein. And then from this liver, the blood will be returning to the inferior vena cava. Okay, so this is a special system in our abdominal pelvic cavity. Is called the portal system. And again, the primary function of the portal system is to clean the blood, okay, from the GI tract, because in our food, maybe we eat a lot of bad substances like drugs, for example, alcohol, and many other toxicants. It will be delivered to liver first. And inside the liver, the bad substances, the drugs, alcohol, all of them will be detoxified by liver. So liver have a very hard job to remove bad materials that coming from our food. And that's the reason why if someone abusing the food or the drug, for example, the first organ that will be affected will be liver, because liver have a very difficult job try to remove these bad materials. Again, if we abusing the drugs, liver mostly will be the first organ that will be affected by drug abuse. From the lower limbs, the veins will, all of them, will be entering into the inferior vena cava from this set of veins. Okay, from the foot, the external and superior set of veins. If we see the pictures, it's going to be coming from the foot, going up, and then finally will combine into the inferior vena cava. And again, remember, veins, there is no pressures on it. Okay, there is no blood pressure. Therefore, most of this vein circulation will be helped by this muscle contraction. So muscle will increase the blood flow from lower part of our body to the top part of the body, to the inferior vena cava. And if, for example, there is a leaky valve, maybe leaky valve in the veins and lower part of our body, then the blood will be going down and causing the vein to be bigger. And this is what we call the varicose vein. We will be able to see that kind of bigger veins under the skin on the lower part of our body. Now, this is the summary of all circulations in our cardiovascular system. Okay, let's say start from the right side over here. So the right ventricle is going to be pulmonary circuit. Okay, and the blood will be blue. The color will be blue because this is poor blood. So this right ventricle receive the poor blood from the right atrium. Right, so right atrium receive all the poor blood from the whole body going down to the right ventricle, and between the right atrium and right ventricle there will be tricuspid. There will be tricuspid valve. From this right ventricle, blood will be pumped through this pulmonary valve, go to the pulmonary trunk, and then go to the lungs, left and right. So it's branching into left and right arteries, and there will be capillaries in the lungs. The blood will receive oxygen. Therefore, the one that leaving the lungs will be red in color because it's going to be rich blood, and this is going to be vein. There are 4 of them. Remember, 2 left pulmonary veins and 2 right pulmonary veins will enter into the left atrium. example here, the blood will be red because a lot of oxygen. So that's pulmonary circuit end. Okay? And then from the left atrium, the rich blood, red in color, go to the left ventricle, okay? Passing the bicuspid valve. And then we're going to start this systemic circulation here from the left ventricle. Pump the blood to aorta, passing the valve is called the aortic valve. And remember, aorta, there are three main parts: ascending aorta, arch of the aorta, and descending aorta. Ascending aorta will give blood to the heart muscle, and then arch of the aorta will be branching into three: brachiocephalic, left common carotid artery, and left subclavian artery. It will give blood to the top part of aorta. Okay, go to the head and also the upper limbs. And then the lower part is going to be descending aorta, going to be thoracic aorta, and then abdominal aorta. All of them will be branching into many smaller arteries, like for example, the one that go to the kidney. It's called the renal artery. It's going to be red in color, and then capillary in the ren, in the kidney, and then end or leave the capillary as a blue color because the blood now will not have the oxygen. So it's going to be vein. It's combined to bigger vein. It's called the inferior vena cava. The one that go to the digestive tract, like stomach, pancreas, intestine, all of them, before going back to the inferior vena cava, have to go to liver, capillaries in liver. And this is what we call the hepatic portal system. This is portal system over here. And then finally, from the liver, going back to the inferior vena cava. The same thing from the trunk of our body, from the lower limbs. All of them will combine to make inferior vena cava, will enter into the right atrium. It's going to be blue in color. The same thing from the top, from the head, from the upper limb, from the chest area, will combine into superior vena cava and will enter into right atrium. The one from the heart is called coronary circulation, will also going back to the right atrium with this coronary signs. So three blood vessels enter into this right atrium, and then it's going down to the right ventricle and start the pulmonary circuit again. So these are the blood vessels, the circulations in our cardiovascular system. Now, what happens if we are growing old? So lifespan changes. Mostly cholesterol depositions in the blood vessel will be increased, causing some atherosclerosis, blocking of the blood circulation. And also coronary arteries will be smaller, narrow, it causing more difficult to deliver blood to the heart muscle. The heart may be shrink slightly or even enlarged due to some disease. Proportion of the heart consisting cardiac muscle will also decline. So our heart muscle will be lower in the activity of pumping the blood. Increase some fiber connective tissue on the heart. It's going to be more difficult to pump the blood. Increase the fat or adipose tissue of the heart valve, and the ventricle wall may be thickened. So again, all of this will causing problems to the heart to pump the blood. Increase in the systolic blood pressure. So normally 120, maybe when we get older, it can reach 140 millimeter per mercury. decrease in resting heart rate, lumens of the large artery become narrow. And this is the reason why the blood pressure increase, because many area in the blood vessel actually become thicker or smaller, causing the heart to pump more blood, to work harder to increase this pressure and decrease the arterial elasticity. So these some of changes that may be happening in older people. Some disease or molecular cardiovascular disease like Marfan syndrome. This is caused by a connective tissue defect, involve an abnormal type of protein, fibrillin, which can weaken the wall of the aorta. So the wall of aorta is weaker compared to the normal person, resulting the bursting of the aorta and causing the sudden death. So basically, the aorta is not as strong as the normal people. Familial hypertrophic cardiomyopathy. This is the defect on myosin. Myosin is one of the protein or filaments of muscle cell. Okay? It's causing the overgrowth of the myocardium, causing abnormal myosin change in cardiac muscle, can result also in sudden death because the muscle, the cardiac muscle, do not pumping the blood. Inherited deficiency of mitochondrial enzyme that break down fatty acid. So the heart failure result from the inability to break down long chain of fatty acid and use them for energy. So the cardiac muscle use them as a primary source of energy. And the last one is familial hypercholesterolemia. So this is a genetic or inherited disease that causing some people have increase of the LDL, low density lipoprotein, or the bad cholesterol, and then it's causing to have high cholesterol levels in the blood. Okay, so this is one of the cause of the coronary artery disease, which is the build-up of cholesterol in the blood vessel. And there are some people that have this inherited disease. It's called the hypercholesterolemia. Coronary artery disease. This is it's considered as the first killer, for people, especially in the United States and also in the world. So this is cardio-arterial disease. This is involving the deposition of cholesterol plaque in the inner wall of the coronary arteries. Remember, there are two coronary arteries, left and right, and these two will be branching into other two arteries. So it's going to be total 4 arteries that carry blood to the cardiac muscles. These obstructions will causing oxygen deficiency on the cardiac muscle. And if it is no oxygen, then there will be no contraction on the cardiac muscles. Often causing pain in the chest and called the angina pectoris, so chest pain. This is caused by these obstructions of coronary arteries, and then it might contribute to the heart attack if it is not, the problem is not solved. Then this angina pectoris will increase to become the heart attacks. And the treatment, the most common one is performing the bypass surgery. So bypass surgery basically actually bypass the bad coronary arteries. So basically the doctor will put new blood vessels from the ascending aorta into the cardiac muscle. Okay, therefore, it's called the bypass surgery, bypassing the bad blood vessel with new blood vessel. I think that's all for this cardiovascular system. So we finish with this system, and then we'll see you again with the next body system. Goodbye.